Welcome everybody to today's Learning Disability Nursing Celebration event. We need to welcome our welcomers, if you like. So Sandra, would you like to introduce Trish?
Yes, please. Yeah, I'm going to welcome in, she's a long-standing associate professor, national roots with the LIBNAN and Books Beyond Words. She has also produced that. Her name is Trish. Welcome, please.
Indeed, and joining Trish for the welcome address is Jess. Jess Ball is one of our second-year learning disability nursing students with a real passion and flair for the field, and has a particular interest. I was hearing a presentation that she did to the community teams in East and West Surrey last week around equine therapy. Trish, Jess, can I ask you to welcome us all to this event?
Good afternoon, everybody. I'm actually wearing lipstick, first time for I can't remember when. So fantastic to see everybody and welcome. I'm going to ask Jess to start, and then I will fill in after Jess.
So just a little bit about myself and kind of where my passions come from with being a learning disability student nurse. Both my parents were learning disability student nurses, followed through, and my mother's just retired after 38 years working for the NHS. So kind of why do I want to do this? Basically, I want to be an advocate for people with a learning disability who need to be heard more. Within the community, we need to be raising awareness of individuals with a learning disability, how we can support them, and sharing experiences with one another, kind of ourselves and within the community of people with learning disabilities. We can help to raise awareness and support these individuals. Everyone is equal. We all started in the same way. So, sharing our experiences, we can share kind of things that we've achieved, challenges that we face, and raise awareness for equality, basically.
Lovely. So thank you, Jess, for that welcome for everyone. And I'd just like to say that, yes, I've been a very proud and passionate learning disabilities nurse for quite a few years now, and seen many changes in my career, right the way through from when I first wanted to start. I wanted to be a domestic science teacher, and I wanted to go to Digby Stewart Teacher Training College, which, as things go round, this is now Kingston University. So I've ended up at Kingston University, and I've been a proud and passionate learning disability nurse for many years. I worked in practice, then went into education, and I must say, Jess has just mentioned her mum and dad. They were some of my first students, so that's even more worrying. That's giving my age away a little bit. But anyway, on behalf of Kingston University, I just want to welcome everybody to today's event. This has really been an exciting event that's been put together to celebrate friendships and relationships. Really, to me, it's the lifelong relationships and friendships, but see how they have stood the test over the last few very challenging months for everybody, and to celebrate some of the great things that are going on. I just want to say as well, this programme has been put together, and today's event very much led by our student nurses, very much in partnership with our learning disability team, which I am very privileged to lead. So I'm going to say thank you very much to Jess, to Jermaine, to Emma and to Sandra for really pulling this together, a very exciting event, and all the work you've done for it, but not forgetting our fantastic learning disability team that's made up of Daniel Marsden, Anne Ambridge, Mark Brown and Marina Russ. And we've got a new senior lecturer joining us in the summer called Sophie Craven. So we're going to be at full strength and verging forward as we always do, because we might be the smallest field, but we're the best field. And I have always said that. So please enjoy today. Kingston University is great. It's #1 in London, and I have to keep saying that. We have some great students, some great presentations, and it's lovely to see you all pushing forward into some fantastic careers and to be able to make that difference, because that's really, really important that we do. And just to say, I'm going to finish now and hand back, but just to say on my passport, my occupation is nurse, and that's what I am. So thank you, Daniel. Thank you, Jess. And we'll look forward to a fantastic afternoon celebrating relationships and friendship.
Before we move on to the next session, I just wanted to add into the conversation. So I know that Sandra's going to be introducing Irena in a moment. Irena and Anastasia won a big award yesterday from, I think it's the Universities Alliance, for their work around online working for with people with learning disabilities. I suspect that, or I hope that that Irena will be able to say more. But I should also just highlight Anastasia has been so crucial in putting today together, and is beavering away in the background and making sure that it all runs properly for us. So thank you to Anastasia for doing that. Sandra, can I hand over to you?
Yes, I'm going to introduce Professor Irene Tofri-Wynne to make my speech, please.
Hello there, and thank you very much. Yeah, that's quite well pronounced. People struggle, Irene, and not bad. I'm also a nurse by background, and I feel in very good company. Really pleased to have so many learning disability nursing students here. You really are the future of this world. So it's lovely to meet you all. So I am going to talk to you for the next half an hour. I don't know whether I can fill the whole half hour, but we'll see. About what we're doing here at Kingston and St George's University in terms of research, because I'm a nurse by background. As I said, I've worked with and lived with people with learning disabilities for many years. I was a member of still am a member of the L'Arche community in South London. I've also worked in a hospice as a nurse for many years, but for the past 2 decades, I've been at first St George's University and then now at joint faculty at Kingston and St George's, doing research. And I really hope, particularly you learning disability student nurses, that you'll come away after half an hour thinking research is what I really want to do. This is brilliant. And I'm particularly keen to share with you what we've been doing about involving people with learning disabilities in the research that we do. And of course, my research has all been around end of life and bereavement care. So that's what those examples will be. I'm also going to tell you a little bit later on about our very brand new group, the Yellow Tulip group, which is, we haven't had a learning disability research group really at the joint faculty, but we just launched one. And I should really be giving this talk together with my colleague, as you can see, that's Richard Keegan-Bull, but he's on holiday, which is probably the better option. And therefore he can't be here today, but I'm just going to introduce him with a little video clip. Richard I'm very excited because he is a research assistant who has a learning disability himself, and we've employed him in January. And in this next sort of few minutes, he just tells you what it's like for him. This is his first paid job with a pension, he said, so he's very excited. You know, nothing is impossible, really. So here he comes.
It feels great to be an employee at the university. You know, makes you feel important. It does, you know, but to be employed by a university and to makes you feel useful and wanted. Yes. My first day at the office, and but with my name on the door where it said Irene Tufnell Professor, then underneath it said Richard Keegan-Bull Research Assistant. And I put that picture on Facebook, and I had so many people who liked it, and he said, well done, and all that. And a good friend of my mum said that he never got his name put on the door, he didn't, you know, but when he was working. So I felt really proud about having my name on the door by the professor's name, yes.
So that's Richard. I'm almost my newest team member, but I'm just going to take you back 2 decades because, as I say, I've been here for 20 years, and I think we were quite pioneering at St George's University to begin with. Has been employing people with learning disabilities as advisors, as researchers, co-researchers for a long time. So here's myself, as you can see, from the not so grey hair and also the very old computer. This is a long time ago. And that's Gary Butler, who was our researcher at the time, helping to advise us on all our projects. And since then, I've done quite a number of research projects, and we've also always worked with research advisory groups that involved people with a learning disability. And that's really important, that you really listen and include those voices, not without its challenges, I have to say, to have meetings where you have people from such different backgrounds and such different levels of education, for example. It's usually the chief executives who really need help in knowing how to be in a meeting that is inclusive, and how to speak a language that we can all understand. That's actually quite a challenge, and a nice one. I've also worked in the last 5 years with a group called the Grassroots Group, which is a group of people with learning disabilities in South London. Actually, now that we've gone on Zoom, there's a few more people joining from beyond London. But I meet with them once a month, and we talk about death and dying, because it's interesting that you're themed today around relationships and friendships, and that's. And we were talking about this yesterday, actually, in the office with my research team, how important it is to build relationships with your researchers, and particularly people with a learning disability who are working with you on research. Quite a lot of it is about relationship, and that can be quite a long-term thing. So it's really worth thinking about that, and the importance of that, not just professionally, but it's really quite wonderful. So these people I would see as my friends, really, as well as my colleagues. But going back to those early days, this is Gary and Amanda Creswell. She's been my co-researcher for a very long time. We were working here, as you can see, on a project. We involve people in all aspects of the research, and not just advising on what we should be doing, but also Gary and Amanda are both involved in helping me run focus groups, for example, and in this picture, data analysis. But we had to train Gary and Amanda on the job, and that's quite a time-consuming and long process. And I've always been frustrated by that, because I don't actually know about you learning disability nursing students, how much research training you get, but I certainly got some training on, on research and how to do with research methods as a student. And we're expecting people with a learning disability to come and join us without such training, and that never really seemed completely right. So I've tried to really sort of, spread the word and share with other people what we've been doing, how we've done it, because it's not just, Gary and Amanda who are learning on the job, it's also I that am learning on the job. I need to learn how to work inclusively. How do you analyze complicated data with people who don't really do complicated words? So, we've always sort of written about that and published it so that other people can take that on. But as I said, I really, really wanted to do some, to find a group of people that we could train as researchers without it being connected to a particular research project. So not training on the job, but actually just to give people an opportunity to see what is research, how do you do it, and would I like to be a researcher? So in 2019, we had a tiny little bit of funding to run this research training course. We, for 8 weeks, we just actually made it up as we went along. I shouldn't say this probably, but because people maybe want to think that it was all very well thought through, but we didn't really know, because it was so new. We didn't know how it would work, and whether people would come, whether people would, whether people would be good students, be able to learn, whether I would, well, rather to say whether I would be able to teach people. So it was an experiment. So I tweeted this once. I have no idea whether anybody would sign up, but we had 25 applications for just 10 places. So it was a little bit sort of wet finger work as to who would be, chosen. Actually, it was a bit names out of a hat. And did this 8-week course. I could talk all afternoon about this course. It was just completely brilliant. And as you can see, actually, Richard was one of the students. It is quite amazing how much people learned. I mean, Daniel, you were part of that when you helped to teach a couple of those sessions. It was just amazing how excited people were about learning about research, how well they wanted to think about it. They were brilliant, and there were 10 students, as I said, and at least 6 or 7 of them, six at least, and probably 7, have since gained new roles that are paid as advisors, and in Richard's case, as we employed him as a researcher. So really successful. This is a picture taken actually just before lockdown in happier times, because after the course, most of the students chose to come back for a number of sessions where we, again, as I said earlier, it's really important to share what you've done. So we thought we'd write an article about this and publish it. And again, it showed me that people with a learning disability, if you give people the right platform and the right support, we're actually really good at this kind of thing, at knowing what what we wanted to write in this article. It's a much better article for having done that together. So that was exciting. So let me talk a little bit about Richard. So Richard, I haven't had a paid researcher in my team who had a learning disability for quite a long time. It's to do with funding. You know, you have to, research projects are usually funded through external funding that you have to apply for and write proposals. I won't bore you with those details. But finally, he's a part of an NIHR study, Growing Older, Planning Ahead, that involves sort of interviewing families and older people with a learning disability. And I've learned really, I suppose, over the years that if you have people with learning disabilities as participants in your study, who are, you interview them or they're part of a focus group, having a researcher with you who also has a learning disability to co-facilitate those interviews is really, really helpful. So we had to employ Richard. That was, well, I'm going to put it mildly, a challenge in itself, because I don't know if any of you've gone to the university employment HR job application systems online. It's not just this university, it's everywhere. Not particularly accessible. So that's Richard, and this is the first time we actually met in person. So Richard and all of us have been working from home online. So Becky in the spotted dress is our researcher, but Jo in the flowery dress is also a new research assistant, and she's working alongside Richard, and that's actually really very nice that they can support each other in their job. Let me just show you then a little bit, as I said, about our learning disability research group. I'm just going to show you the beginning, I think, of, if this works, of our launch event. The meetings have to be friendly, don't they, and sort of easy for everyone.
Yes, they do have to be. If they can't talk in a higher level, but talk in a medium level, where everybody understands.
Okay, I'm going to stop the video there, because this was from our first meeting, the launch meeting. But as you can see, we meet now once a month. We've had 2 meetings, and they've been really quite, it's interesting that it's attended by people from the faculty and hopefully some students. And I hope that all of you nursing students are inspired to join our meetings now. The next one is on Tuesday next week at 12 o'clock, I think. Yes, 12 o'clock. We're going to talk about research advisory groups. I showed you some of those pictures earlier and how to run them. And we're having quite a lot of people with learning disabilities joining, actually, from not just Richard and people from MENCAP, but also from other universities. It seems there's a real need there to find a space where we can think about these things together. So you're all really welcome. Email me if you want to join those meetings and put on our mailing list, so then we can notify you of future meetings. They're fairly informal, I hope. We run them on Zoom. So yeah, just come along. Here's a picture of our last meeting. As you can see, it's quite a lovely, friendly group. And I'm not quite sure how that's going to develop. And I think that is actually quite typical from most things that we do, because doing research with people with learning disabilities and setting up those kind of groups, those kind of meetings, it's all quite new. Even the research training, reinventing wheels really. So I'm not quite sure how this group will develop, but if you join us, you and I together will find out what's going to happen next. And then finally, this is our newest project. We've just been given the funding for being part of the LEADER project, so the Learning Disability Mortality Review that's run by NHS England. And Richard and I are leading the co-production part of that. So the data analysis of all these mortality reviews will be done at King's College London, but here at St George's in Kingston, we will run a monthly group to look at the data together. So there'll be 6 people with learning disabilities who will be paid to meet together for the next number of years to look at the LEADER data and give the learning disability perspective on how things can be improved for people with learning disabilities at the end of life. So we'll start in September. We will start by training the group and giving interview and focus group training. We've had some experience recently, as you can see in the bottom picture, of doing that kind of training on Zoom, and that seems to work quite well. So I'm quite excited about this. And the thought occurs, actually, we have some funding to have somebody to work alongside Richard for 4 hours a week on this particular project. So I haven't found anybody yet, but if you think you'd be interested in doing that, probably on a Monday, then this is your job advert, right? Come and email me and say, I'm really interested in working with Richard and with myself for the next couple of years on this project, and we'll see what we can do. And finally, as Daniel mentioned, yes, we won this award yesterday, the Innovation Award from the University Alliance, and that was another, as a result of some work we've done, having teamed up with the PCPLD, that stands for Palliative Care for People with Learning Disabilities Network. And our university, particularly Anastasia, I must mention your name, Anastasia, because you've been really the star behind all this. Has developed a whole series of webinars on supporting people at the end of life and in bereavement, particularly during COVID. And we've had thousands of people joining those and viewing those. So we run those every month now. And again, actually, I'm just looking at my diary. The next one is on the 13th of July at 12:30. And I'm sure Anastasia can send out invites for that. So we can now say, come to our award-winning webinar, 1 hour at lunchtime. The next one is going to be on involving people with learning disabilities in end-of-life decision-making. So that's really going to be really quite interesting. And that's it. I've just got my website here. If you're interested in any of the things I've talked about, then go to my website or, email me. That's all I've got to say. I think that was half an hour. I think I've done all right there, Daniel, or have I got 5 minutes left to say more, or people asking questions or whatever?
I'm sure people would like to ask questions. I know that Sandra and I probably would, if nothing else. I'm really interested. What had you choose to step into the world of intellectual disabilities, learning disabilities?
The correct answer to that probably is it was a good opportunity to learn to speak English.
Okay.
Right. But it was part of my nursing training in the Netherlands. Nursing training, it was novel at the time, but it trained you for 5 fields of nursing: learning disability, general hospital, psychiatry, district nursing. So learning disability was part of that in one of my placements, and I think probably the one I enjoyed most. But I do remember, again, interesting with relationships, being told off by my supervisors for making creating too good a relationship with some of the people we supported in that ward. So that is not right because they only miss you when you go, sort of thing. So I then I came to London from the Netherlands to live in the Large community with people with learning disabilities. And interesting, Richard is also part of that community. I didn't know him at the time because he joined much well after I left living there, but I lived there for, well, what I thought was going to be 6 months to learn English, and I ended up, well, I'm still here. It's 35 years later. I'm still a member of that community, but I lived there for many, many years. And I think it's interesting because I think that has really taught me, the people that I lived with, again, the value of relationships and how important it is to do things together. And I think that is, so in a way, the people I lived with in the Large community, people with some with quite profound learning disability, really have taught me how to be an inclusive researcher. So that is, yeah, that's what got me into it, I think.
Thank you. Have we got any other questions for Irena while we have her?
Yeah, I have. It's really amazing with the job you've been doing, and I'm really curious, how were you able to jump over every obstacle or any setback you really encountered in terms of putting researches in place, funding, and all that? I think that must really be. I think there must be a dance time and also lifting time. How did you come over those moments?
Yeah, that's a really good question. I think, you know, if you think something is right, that you want to do something, then you just stick with it. I mean, many times, you know, it's very hard, for example, to get research funding for learning disability research. I've had so many rejections, having spent, you know, for funders, and every time somebody says, oh, that's a really good, wonderful project, but no, we're not going to fund it, I'm seriously thinking of changing jobs and giving up, right? Thinking I need to spend my time on something that is more useful. But, you know, and people say, oh, why don't you do research in dementia or in things that are, you know, that are maybe a little bit more, people understand what it is needed. You know, people who don't know about learning disability, when I tell them that there are more people with learning disabilities in England than there are people with dementia, I tell doctors this, you know, and they're amazed because they get lots of training on dementia and none on learning disability. So I think just stick with it, and as I really sort of tell people about what you're doing, and you know, I mean, often you don't know what the use is of something, and you just keep going and don't take no for an answer, and say, well, you know, this is important, and building relationships, you know, like my grassroots group, we've been meeting every month for the last 5 years. Most of it was on my day off at the time because you know, it wasn't really part of the paid job. But I just knew it was important. And now you can see with these webinars, for example, that grassroots group have been really crucial in that because they contribute and it's, yeah. So, I mean, winning the award yesterday, it just goes to show how this year, I suppose, we've really seen how much what we do is needed. And that is actually quite nice to see, because you don't often, as nurses as well, you don't often see what the effect is of what you've done. And I think all you learning disability nurses, you know, you may do something, say something to somebody and move on. And you know, sometimes I go and come back 10 years later and people have remembered the things you've done and said that you've all forgotten. You make a huge difference, you know, just know that you really are able to make a difference. Yeah, so keep going with what you believe in. And
Wow.
find like-minded spirits, right? That's also, so it's lovely to be here at Kingston at the joint faculty and have some people here who really believe in it as well. And I have to say, I've been really lucky that this faculty has been so supportive of what I do, because it isn't always what's on the job description, and I've just make it up as I go along. But, you know, having people believe in you is great as well.
Yeah, thank you very much. That's really touching. Yeah, we're gonna be seeing a short film. It's about relationship in lockdown, and I think it's two films actually. So this is gonna be for is relating to maintaining relationship and friendship in lockdown, and this is it's gonna feature academic students, partners with learning disability. So hope you enjoy that.
Very mindful of my family right now. You know, we've all been cooped up in our house together for a significant period of time. Through the lack of a commute to work and seeing people at work, we became a lot more localised as well. We live on a square, and while we knew a few people around the square and knew some of our neighbours, we got to know them a lot better during lockdown. We ran some quizzes in the online environment. We did some joint artwork together, and you know, the outcome of which is that we're having a square fete on July the 4th. From a professional point of view, I'm quite comfortable in the online environment, and have done a fair amount of work with Zoom, and we just rescheduled everything and put it in a Zoom environment, and we adapted very quickly to those changes. The other inspiration that I guess that I think that this provided was the an awareness of the challenges that people with learning disabilities were facing, and that of their families, and that of our student nurses and the qualified nurses that are out there who were providing that expert support. Relationships for me about lockdown was that, you know, it gave some opportunity for time to create new connections, to create new opportunities and possibilities, and new pieces of work came out of it.
During the lockdown, I should have to keep myself busy doing the running up, and try to be able to stay with my family. That gave me more joy, and it helps me to be more focused and study and try to do some research regarding my assignments. And towards that time, I feel really relaxed and more thinking and focus.
How have I managed and coped during lockdown? So I'm really fortunate as I live at home with my husband. He's been looking after me really well while I've been working at home. He's been bringing me coffee, my lunch and snacks. My son, unfortunately for me, but fortunately for him, lives in Australia, which is a long way away. So I've been speaking to him via messenger every couple of days. My daughter lives locally, and I have spoken to her regularly and seen her, but from the end of the drive, I think it has been really important to keep in contact with people. And my family all live in the north of England, so I've sent people cards, I've sent people letters, and I've also sent some food hampers to some of the older members of the family who've been isolated, because it's really nice to get something special. There's a care home down the end of my road. And I thought to myself how sad it was that people weren't having visitors. I organised all the neighbours and asked them to donate gifts, cards, messages. Children drew pictures. We had little plants from people's gardens, and that was to raise people's spirits. Because I think through all this, the most important thing that I think I've learned is it's really nice to be kind and to do things for other people.
So, relationships and friendships in lockdown, reflecting on the past year, 15 months. On a personal level, trying to keep in contact with people, it's been really important for us all because it's reduced that feeling of loneliness. From a professional point of view, it was, at the beginning of the pandemic, I was full-time working for myself on the front line, working with individuals. I'd never really used Zoom, so having to sort of shut down from visits and work for a couple of weeks just to get to grips with everything. But now, you know, it's very much a case of I do a lot of Zooms. As lockdown is being released, we're starting to do some visits, still doing social distancing. There was a lot of services that felt that they couldn't do those sorts of things. Now, doing online sessions with people, doing webinars for groups of people, it's second nature. Part of the way through the pandemic, I became a part-time senior lecturer at Kingston University. At a time when there was very little in the way of face-to-face teaching, we couldn't really meet our colleagues. When I reflect over this past year, it's made me think of those things that are most precious and the things that we shouldn't take for granted, but also how we need to be more than ever thinking outside the box and considering what we can and can't do, ensuring that we don't give up. We keep on going.
I must say, during the COVID time, lockdown, I was a bit stressed, to be honest, because sometimes when we're doing the online studies, my internet is not stable and it frustrated me, kind of. Here I am, the lockdown is about to ease up and I can't wait for everything to go.
In some ways, it's made me make more efforts to stay in contact with people, particularly with various friends and family members who were all over the country. I think, like many others, I've spent a lot of time kind of stuck in the house. I think what might have been different for me is I did change jobs and essentially careers kind of halfway through the pandemic. So I spent most of last year kind of really working in a frontline role. So I was still going into work, visiting people with learning disabilities in their homes and in services. And then really moving into education, I've now spend 90% of my time sat in my spare room talking to myself on the screen. You know, that's been a very positive move, but it's also been quite challenging to kind of settle into a new role and into a new team when I can probably count on the finger of one hand the amount of times that I've actually seen my colleagues in the 8 months now that I've been at the university. Because when you move into a new job, there's things that you don't know, there's things that you need to ask people, and often those conversations would happen in the corridor or happen over a cup of coffee. Our first year students have started on their nurse education journey when they're not getting that time really to be together, to learn from each other as much as they generally would have done.
How did I support myself during lockdown? Well, I play a lot of video games, a long workout in Battersea Park, and try to get in touch as long as possible with my family, which they live in another country. There is no really tips there that I can give. I just enjoy the few times that you are free and study as less as possible.
It's been really difficult staying in contact with some of my friends during the pandemic because I haven't been able to see them face to face and I miss the physical contact with them. By that, I mean being able to hug.
So what could have been done better so you could have stayed connected with your friends and family?
Maybe risk assessments put in place a bit sooner, because I found when certain things opened up, I struggled with not being able to attend those things. With the family, I stay in contact with them anyway via text and phone, so that's not a big issue, although I did find it difficult choosing between mum or dad to come and visit me.
Is with my partner. We've just grown as a couple together, and although it's been tough, we learned how to communicate better and how to deal with the goods and the bads of our relationship. And
even though I've been at home since last year March, I've still managed to take part in filming. Has been very exciting and good because it's been taking part in projects for Kingston University and other places as well. Still managed to keep my professional with healthcare professional as well as being at home.
Being at home has been tough, but I've adapted. My relationship with my sister has never been stronger.
I made sure that I was spending time with my family, also contacting my friends, making sure that I was messaging them and getting their support during lockdown, so that I wasn't isolated, because I know that some students can also get very into their work and isolated, and it can affect their mental health. So made sure that I was connected with the ones that I love, and that helped me balance my life and stay healthy.
For me, what this year has meant is a great deal of sharing. And I think sharing in sadness, in losing my brother-in-law to COVID, but sharing in joy at the birth of my goddaughter's daughter Poppy, who's a year today, and sharing that through a WhatsApp group. I mean, that was unique to actually live and breathe labour through a WhatsApp group. But hey, that was great. Along with pride in our key workers and our service users who have overcome countless boundaries to make real achievements. And finally, taking great pride in seeing our students progress through the course. This has been a real challenge to some of them, but passing and becoming a registered nurse is the best thing ever. And even more importantly, being a learning disabilities nurse.
I think it's going to be a bright future.
Thank you to everybody who contributed towards that film. We're very lucky that we've got such great practice partners and supporters, and as well as our students in the field, and obviously our team around us to be able to contribute to that. I think it's really important to think about some of the narratives and the stories of how things have changed, and I know that there's work going on to ensure that the voices of people with learning disabilities and their experiences of COVID and of lockdown and of the pandemic are not going to be lost.
Yeah, so at the beginning, I think everyone can agree that it was a very nerve-wracking place to be as a student nurse, and thinking, how is this going to work? How are we going to be learning virtually? From being in a lecture theatre to then being in your own environment and having to Zoom call in. There was, you had to get the right balance of lectures and sitting at a screen and staring at it for a day, because it was quite intense. I can say, hand on my heart, I would turn my camera off and find other things to do at times at the beginning, because I just didn't know how I was going to cope. But now it's just the world that we live in. And I think we've all got very good at adapting to how this is the way, and, recognising the support systems that are there and using them, and being, I think someone mentioned it, that, it's okay to know that you're struggling. We all have challenges. It's only natural. And it's good to realise that when you're struggling, there are people out there that can help, whether you're struggling, with your studies or whether you're struggling with personal things. University have been great for myself with coping with things, and it's just recognising that there are people out there that you can connect with. So yeah, there's support in all different shapes and forms, and just kind of realising that if you need that support, that someone is out there. And yeah, but one would hope that things will be starting to get back together in the near future anyway.
I think that we certainly hope that, certainly from an academic point of view, that is the case. I think one thing that we've really missed is seeing the students and being able to have that interaction and to be able to, you know, develop and maintain those relationships with the students, and, you know, look at how you're doing, and be able to provide much more of that support.
So we work quite closely with people from the Baked Bean Company to do our skills and simulations. And one of the for the module that I run around assessment and care process, that I think Jess has been part of, as well as a number of other second years that will be in the room today, is that we would part of the formative assessment for that module, we would do a simulated assessment. Now, obviously, that fell right at the turn of the year. We weren't able to do that, but we were very aware in our communication with Hannah and Baked Bean that they've been doing some really excellent work around supporting their actors and their members with teaching them how to use Zoom and encouraging them to use these kind of online environments. And we ended up doing that simulated assessment in a room a bit like this, and the students got a recording of it to take away to reflect upon, and to be able to do their reflective reports. So, you know, I guess that what we've done is we've obviously adapted our assessment method there, but it's also based on some of the adaptations that others have made to be able to support in this online environment. I know that, you know, some of the students. So Jess, I believe you've been out in community placements recently, but I know that not all community placements are ready to take students currently. What's your experience been like, Jess?
So again, I was very kind of nervous of how I would achieve my placements. So for any students out there, I'm sure that they can sympathise with this, is that I was kind of wondering, how on earth is my placement going to get to gain trust of me as a student, and know my limitations and know what I can and can't do. And I have to say, you know, hats off, I will give them recognition for SABP's East Surrey community team for adults with learning disabilities. They have been phenomenal at creating a safe space for me to work in, both virtually and when I've been able to go in. I have been doing blended learning. I have been in the office at times, but the majority of it has been from home. And it's kind of being able to be flexible in the way that you work, being autonomous in how you work, and with the limitations, but saying when you don't know things, you know, I will put my hands up if I don't understand something, or I can't do something, or if I don't feel comfortable. You just have to say, and that people will support you. But it's been a great placement. You know, finishing tomorrow with them, I'll be very sad to leave the team. But I found that, you know, community teams have adapted very well, and the people they support have still been getting the support. Maybe it might not be face to face, but they have been still getting support throughout the pandemic, which has been great and managed very well.
I'm going to introduce John Golden. His background in finance, shared care organization, and we also provide quality care through enabling and valuing front staff. And yeah, hand over to you, John.
Thank you very much to Kingston and St George's for giving me the opportunity to be involved with this. It's been fascinating to hear the discussion so far. So I'm going to hopefully give you a little bit of a flavour of what it's been like for us as a provider of services for people with learning disability, as well as physical disability and other diagnoses through this pandemic. For those of you that don't know about Salutum, We are a care provider that operate out of 140 services across the country, quite a few different types of service, but mostly focused upon the more complex care needs. So we've obviously had over the last 15, 16 months the experience of dealing with the curved ball that COVID-19 has brought with it, in the context of caring for and working with people with complex needs, including learning disabilities. And I've got to tell you, it's been fascinating, and we've had, together with everybody else, some incredible lows and some incredible highs, and it's definitely been an experience. And I think arguably we would suggest that it's been quite a good experience on balance, although of course would have preferred that there was no pandemic out there. As with all things, we find when we're working with people whose needs are complex in many ways, the simple acts of living involve things being magnified. Issues get magnified, and the tasks and the decisions of life are magnified compared to people that don't have those complexities. So what I want to talk about, I'm just going to take a few minutes. First of all, I'm going to do this sort of fairly cold, what it felt like from an organizational perspective to deal with the pandemic. Then moving on to the more important and more refreshing side of things, which is the experience of those people in our care who have LD, and how they dealt with it, and how actually we learned from them and with them, and then some of the lessons learned about what we got from it, which have been both good and bad. So obviously I'm in the privileged position of being a chief executive, and what that means in practical terms is that I can get somebody else to write slides for me, and I just get to speak. So I might be talking rubbish, but if you read the slides, they're probably a lot more sensible. So when we were faced with the outbreak back in March last year, obviously we have to look at everything through the lens of an organization that has no choice but to continue and to be very reactive and swift. And I've heard through a number of the conversations and comments that have been made today that those are the things that have proven to be quite important. It's not just about getting it right; it's about getting it right quickly, because the people who are relying upon us can't sit around and wait for us to be making decisions or making things happen or making things change. We had to be quick and decisive, and of course that was difficult for everybody back in March. I mean, it really was a lurch into the unknown. We didn't know what to expect. We didn't know what we had to do. We didn't know how long it was going to be, and taking colleagues with us on that journey was difficult, but taking people with the challenges of learning disabilities required more thought and more sharing. But nonetheless, we had to do things quickly, and we tried to get things right and keep things stable as much as we could. And none of the issues that we faced were anything different to what everybody else has been talking about and what everybody else has faced. The initial lockdown was the first thing that hit. What did that look like? What did that mean? What could we do? What couldn't we do? How was that going to affect everybody? Being a care organization, being involved in anything clinical, medical, or social care, we couldn't just stop. That wasn't an option we had. Lots of organizations did have the ability to just turn things off and stop. We didn't have that. Our staff had to turn up to our care facilities every day, and we needed to make that safe. But we did put a perimeter in pretty quickly. We did stop as many of the interactions with the outside world as we could sensibly and safely do. But again, remember what it was like. We didn't know whether this was going to be for a month, 6 months, or as it's turned out to be, a lot longer than that. So the first thing that, and again, this has been touched on quite a lot, the first thing that was apparent is that people are a lot more resilient than we'd anticipated, and that is true of both our staff teams, but also the people we care for. And of course, it was difficult, and of course, there were tough times, and people got upset, and people, felt that in a number of different ways. But the resilience across the social care world generally was just phenomenal, extraordinary. You'll have heard the stories of staff teams isolating themselves with the people they care for, and taking time away from their families to deliver care for people who needed that, who relied upon that, and they did it, with a skip, with a smile, but it was tough, for sure. It was tough, and we had to have that level of continuity in what we did, but stay safe. And the advantage we had versus as a care organization versus other types of organization is that infection control was something that we already were practicing, we already understood. So that did give us quite an advantage. We'd already been using PPE. I mean, for probably 95% of the population, PPE is something that never entered their minds prior to March last year. But it was something that we were already practiced in, and knew how to use, and knew the pros and cons of that. And in the context of dealing with people with learning disabilities, just wrapping yourself up in PPE to keep you and them safe isn't that easy. It does breed an awful lot of issues around communication, around fears, and around people's ability to relate one on the other. We have got in the services that we run, we have got some world-class huggers amongst them. They really do seem to be very, very good at hugging, and that's a great thing. But that's something that had to pretty much stop, and certainly be discouraged. But amongst all of this, of course, it is very important to share information, and we learned very quickly that everybody needed to understand why we were making decisions. And one of the early decisions that was very impactful was stopping family members and friends visiting a lot of the services, and that's not for free. That really is something that we all now know is very important and difficult, but people understand it, or people accept it if they understand why it's being done, that it's for their own reasons. And that communication and making sure that that was done properly in a style and with the sort of substance that people with learning disabilities could fully comprehend was a challenge. We like to think we're good at that, but it remains a very strong challenge. But all of the issues that we had to go through needed to be done in a very personalized way. We're very conscious, even though we're a fairly large organization, that at the end of the day, we are people looking after people. And we need to make sure that everything we did reflected that. What did it look like for the people with learning disabilities? And again, it's just back to this issue of magnifying all of the conversations and the factors that everybody was having to deal with. And I've thrown a few up here just to give some insight into how we approached them and the feedback we got. Vaccination and the discussion around that has been front and central for the last 6 months. And indeed, in the last couple of weeks, the government have announced their intention to pursue a policy of mandatory vaccination for staff who work in care settings. So we saw this coming last summer. There was a hope and an expectation that a vaccine would be ready, and that would be something we would need to discuss with those in our care. And it's not just about the vaccination of the staff; it's also about vaccination of the individuals we support. So having that conversation with them in a meaningful way was very, very important. And I guess we shouldn't be surprised that they approached it broadly in a very simplistic way, which is, well, what's it going to do? Is it going to make me safe? And one of the things I guess that hit me between the eyes was a lot of the people in our care were more concerned about keeping those that cared for them safe than necessarily their own safety. We've got a children's service in Essex for teenagers with learning disabilities, and they very much at a very early stage of the pandemic took it upon themselves to keep the adult staff who were caring for them safe. Children can struggle with wearing masks in public places, and clearly the vaccine wasn't necessarily an issue that affected them directly, but they were very, very keen to keep the staff around them safe, which was fantastic. And across the we look after around about 1,500 people, and the vaccination rate amongst the people that we support is around about 98%, which is very strong, and it shows that they've engaged with that, they've understood it. We've ensured that they really are making informed decisions around that. A few of them have chosen not to do that. That's okay. We'll continue to talk with them about that, but it's not mandatory for them, and we carry on. Wearing of a face mask is another one that is difficult for everybody, and of course we've seen people's different reactions to that. But for somebody with learning disabilities, again, everything is enhanced, much more sensitive to this in many cases, and communication is something that is affected by it, but also it's that discomfort, and some people with learning disabilities really struggle with that. We just had to approach it in a very individualized way, and ensure that they were informed, comfortable with what's being proposed and why, and everything properly risk assessed where they weren't able to engage with it in a full way. And it's a very interesting comment that somebody made in your earlier film, that it's speed of those risk assessments that's so important. You listen to people, that's great. You take it on board, that's great. But don't leave them hanging for 2-3 weeks while you make a decision about whether they can go out without a mask. Do it quickly. That's very important. Seeing and communicating with family and friends. That became I will actually call it a battleground. The government were putting out a lot of rules, a lot of regulations that we were having to conform to, and it actually illustrated the different care settings and the advantages and different disadvantages of different types of care setting. We have residential care settings, and we also have supported living, and some key differences were highlighted in how you could see and communicate with your family and friends between those care settings. The residential model was much more difficult to enable people to have family visits as things started opening up in the various phases than in supported living, where there was more individualized control of environment. So supported living was easier to resolve and enable that than residential. Some of the advantages of the residential model became apparent in use of PPE, access to vaccines, and some other things. So there were swings and roundabouts that we had to deal with there. What else being treated fairly. That is something that we all expect. And we do have challenges with this. All of you are involved in the care and working with people with learning disabilities, and you'll know that this is a constant battle. I've actually put up here something which is quite a sensitive issue, which was the use of DNRs and support in hospital. Certainly in the earlier phases of the pandemic, we had some real problems with this, with blanket DNRs being put in place, which were extremely distressing, actually. And we had to be very much on guard where those were being put in place. There was a fairly conscious news stream on this about 2 months ago. Case of a poor lady who had a DNR put on her when she went into hospital because she had learning disabilities. The staff from the residential setting she was in, were unable to be in hospital with her because of the rules. There was miscommunication going on. A DNR was put in place, and sadly she did pass away in a not particularly comfortable way. And there's a campaign to ensure that isn't happening, and people are being treated fairly no matter what their challenges. And we like to be a part of that. I mean, the individual who got a lot of news attention, or her family got a lot of news attention back in May. She was actually from one of our services, so we're pretty close to that one. So we had to, through the whole thing, make sure that we were doing everything from the viewpoint of those that are in our care, and happily they're able to contribute to that, and we made sure they were able to contribute to that. Yeah, communication was absolutely key. We really had to up our game, and I think this has been true of all organisations and all types of interaction. We found that we couldn't communicate with enough of the people fast enough across our organisation. We could communicate with service managers, but not with people on the front line, and our communication with those in our care was insufficient. So we really had to up our game on that, and that's been something that the pandemic has taught us and has been a benefit. And we really needed to make sure that we were involving everybody, those in our care, all of our staff, frontline, and people involved in policy and strategy, all the commissioners, making sure that their voice was being heard, but also they were getting the correct information from us and the correct feedback from us, and other medical and clinical practitioners that are involved in that care. And that has been a challenge for everybody, and particularly with people whose communication is more difficult than others. But just because it's more difficult is no excuse to not try. And we've ensured that everybody's best interests are really taken to heart and are reflected, which hasn't always, it's not always possible to deliver exactly what they want. And in the last couple of months, it's been very much about people wanting to break free, wanting to get back into their interests, their day services, their normality, and having to rein that back a little bit has been tough. But again, taking everybody with us on that journey, getting them to understand that why it's needing to be done and what being safe means in this context has been helpful. Yeah, I mean, look, we're sort of sitting here in mid part of 21, feeling, I guess, a little bit smug, because as an organisation, I think we felt that we've done quite well through the pandemic, and we're able to say that because we feel that we've been led by the people in our care, and we've not dictated to them. They have dictated to us as much as possible, and we've managed to find a nice balance between the rules and regulations that were changing fairly often and could be quite challenging, and the real needs of the people who rely upon us to lead meaningful and fulfilled lives. Yeah, lots of lessons learned. Some of it's been enjoyable to share, some of it's been very, very difficult to endure, but we actually feel that our colleagues have come out of it stronger, and the care that we're giving is hopefully going to be improved for that. So thanks very much for the opportunity to talk to you, and if you have any questions and comments, I guess you can do it on the messaging or whatever. Thanks, Daniel.
Thanks, John. That's great that you've been able to join us and share a little bit with us about the Salutum and your experiences of care provision across the pandemic. you know, we probably ought to identify that one of the reasons why you've joined us today is because your organisation is supporting a couple of our students through the course this year through the scholarship, for which we're obviously grateful, and so are the students. So thank you for that. And one element really struck me through the at the beginning of your presentation was this idea about the fact that care doesn't stop. That, you know, given the pandemic and the fact that a lot of lives slowed down or changed speed, you know, ultimately care provisions still remains, and that is something that perhaps we've all had to grasp. But perhaps the pressures on you within direct care provision must be great.